coronavirus, COVID-19, is all around us. And I know many are anxious, worried, and confused, and that's absolutely natural. We are facing a health threat unlike any other in our lifetimes. Meanwhile, the virus is spreading, the danger is growing, and our health systems, economies, and day-to-day lives are being severely tested. The most vulnerable are the most affected, particularly our elderly and those with pre-existing medical conditions, those without access to reliable health care, and those in poverty or living on the edge. The social and economic fallout from the combination of the pandemic and slowing economies will affect most of us for some months. But the spread of the virus will peak, our economies will recover, and until then we must act together to slow the spread of the virus and look after each other. This is a time for prudence, not panic, science, not stigma, facts, not fear. Even though the situation has been classified as a pandemic, it is one we can control. We can slow down transmissions, prevent infections, and save lives. But that will take unprecedented personal, national, and international action. We must declare war on this virus. And that means countries have a responsibility to gear up, step up, and scale up. By implementing effective containment strategies, by activating and enhancing emergency response systems, by dramatically increasing testing capacity and care for patients, by readying hospitals, ensuring they have the space, supplies, and needed personnel, and by developing life-saving medical interventions. And all of us have a responsibility too, to follow medical advice and take simple, practical steps recommended by health authorities. In addition to being a public health crisis, the virus is infecting the global economy. Financial markets have been hard hit by the uncertainty, global supply chains have been disrupted, investment and consumer demand have plunged, with a real rising risk of a global recession. United Nations economists estimate that the virus could cost the global economy at least $1 trillion this year, and perhaps more. No country can do it alone. More than ever, governments must cooperate to revitalize economies, expand public investment, boost trade, and ensure targeted support for the people and communities most affected by the disease or more vulnerable to the negative economic impacts, including women, who often shoulder a disproportionate burden of care work. Dear friends, a pandemic drives home the essential interconnectedness of our human family. Preventing the further spread of COVID-19 is a shared responsibility for us all. The United Nations, including the World Health Organization, is fully mobilized. As part of our human family, we are working 24/7 with governments, providing international guidance, helping the world take on this threat. We stand in full solidarity with you. We are in this together, and we will get through this together. Thank you.
Well, we are going to take the powers to make sure that we can quarantine people if they are a risk to public health. Protection of the vulnerable and elderly by asking them to stay away, to stay at home. That is in our action plan. That'll be in the coming weeks. And getting this...
Next week, possibly.
I'm not going to go into any more detail on the timings because we want to be ready to say that when we judge, based on the scientific advice, that the time has come. But we will be taking further measures. We will change the law so that we take the power to be able to close mass gatherings if we need to. We want anybody who has the manufacturing capability to turn to manufacture ventilators to do that. We will be stopping some other activity and asking doctors who normally do other things to retrain to be able to, for instance, use the ventilators.
And you could do that quickly enough to...
Theatre, and on Wednesday, Thursday, and Friday, they'll be here at the Vancouver Cabinet offices. And with that, I'd like to introduce our Provincial Health Officer, Dr. Bonnie Henry.
Thank you, and good morning, or good afternoon. So today we have a couple of things to talk about. First of all, we have 9 new cases that were identified in the last day here in British Columbia. So that brings us to a total of 73 confirmed cases. 7 of those people were in Vancouver Coastal, 1 in Fraser Health, and one which is still presumptive, but we expect it to be positive in interior health. So that will be the second case confirmed in interior health. The interior health case is related to travel to a number of places in Europe, most recently from Portugal. Also want to talk a little bit about the outbreaks that are ongoing. So most of the cases today that we're announcing are related to the outbreak. Particularly the outbreak at the Lynn Valley Care Centre. We now have 4 residents who have tested positive and 12 staff who have been positive for COVID-19 from the Lynn Valley Care Centre. And Vancouver Coastal continues to monitor all of the staff and residents associated with that facility. And we know that there's some ongoing testing of others who are starting to show symptoms as well. This is not a surprise. When we first recognized the outbreak, it had just been starting, so we know that people are in that incubation period, and there may be more cases that arise in the coming days. The second outbreak that we're being monitored at Hollyburn House continues to have 1 staff person and 1 resident who are positive. Again, testing is ongoing. And previously I had indicated that there were 2 staff at Hollyburn that had tested positive, and there was a bit of a mix-up. That was actually a staff person was associated with the Lynn Valley Care Centre. So currently at Hollyburn, there's just a single staff person and 1 resident at this time. And the Lionsgate cluster of cases remains at 3 people who were in the admin section at Lionsgate. Additionally, 2 of the people that we announced earlier this week who were in Vancouver Coastal Health, they actually reside in Northern Health, and under strict protocols, they drove themselves home, and so they're now in isolation at home in Northern Health. Just to be clear, so we have people in all of our health authorities that are at home in isolation with COVID-19. One of the most important things I want to talk about today is about our testing strategy, and we've been talking about this all along. With the new restrictions and advice that we're putting out around people returning from travel anywhere outside of Canada, it's not essential, and we don't need to test everybody who's been outside the country, even if they have mild illness. So we need to adapt, and we are adapting our testing strategy to respond to the situation that we do have here in BC now. For most people, you do not need a test. And we want to make sure that testing is available for all who do need it. And the focus will be on ensuring that we will continue to test people in active investigations and cluster outbreaks, because that's how we determine how this virus is spreading in our community. Healthcare workers, importantly, people who are in hospital and we need to understand what is causing their illness, or people who have more severe illness, and people in long-term care homes. That's the focus for the testing right now. And we want to ensure that everybody who gets sick gets the testing they need. For everybody else, even if you have mild symptoms or you have no symptoms and you've returned from travel, you don't need testing. And we want to make sure that people with no symptoms understand that they don't need to be tested for COVID-19. People with mild symptoms and returning travelers who are isolating at home do not need to be tested unless you get sick enough to require health care. So that's a really important message. We need to focus our testing so that we're able to ensure that those who need this test are able to get it. And finally, I want to ask everybody in British Columbia to be measured in their purchase of groceries and other basic necessities. We've seen in other parts of Canada and certainly some parts of BC, but people are I think it's natural when you're in a situation like this where there's a lot of unknowns and there's a lot of concern about what's happening with this virus and the impact it's going to have on us and our families. And one of the ways that people do try and get some control over their environment is to make sure they're doing things like stocking up on things, and that can be provoked by anxiety. So I want people to be calm, to be reassured. We've been reassured by our retailers that our supply chains are strong and that they are restocking the shelves, and it really is a function of demand, and that we don't have an issue of not having enough supply. So I want to assure everybody that the supply is there, and we need to be measured in our approach and get what we need, but not to hoard and not to have anxiety-provoked purchasing. There's no need for that right now. We know that there's been a lot of events canceled. There's a lot of concerns about what's happening in our community, and I encourage everybody to take the time now to spend the time with their families, to go outdoors, to take advantage of the time and the space that we have, but to do it together in small groups, not to congregate in indoors in large groups, and to support each other across our communities. And we will get through this. It's going to be a challenging time for all of us. But now's the time for working together. It's a time for compassion. It's a time for supporting each other. Thank you.
Thank you. And as Dr. Henry has said, that's 9 new cases today. We continue, of course, to be extremely concerned about the situation at the Lynn Valley Care Home. That goes without saying. And it is a good reminder to reinforce what we continue to say about all care homes in BC, that people, we have to be very careful not to visit care homes or anywhere, but care homes if we're sick, not to visit parents or grandparents who are our elders if you're sick, not to visit them, and to provide support in trying to address the possible social isolation people may feel as a result of that through other means, through regular contacts over the phone or on FaceTime or however people choose to do that. It's obviously critically important in that effort. I want to reinforce what Dr. Henry has said about testing. I think, as noted yesterday, the people at the BC CDC and in the health authorities have done an extraordinary job with testing. There is a clear direction in testing policy for us to be effective in containing and slowing down COVID-19 in BC. As Dr. Henry has said, we have to prioritize, and that includes prioritizing on current investigations, prioritizing on healthcare workers, prioritizing on people in hospital and around hospital. And so what we're asking people to do with mild illness is to isolate at home, and the direction to all people returning to Canada to isolate at home for 14 days is an important one in what they need to do. Obviously, if people are seriously ill, they need to contact and get assistance for that. But we need to help everybody in our society to ensure that the extraordinary efforts towards testing are prioritized to help everybody and to reduce the scope of the outbreak. I want to say with respect to testing centers that there will be so-called testing centers set up with these criteria in mind in health authorities, and health authorities in the coming day and days will be announcing locations for those, and we'll be managing that. But I think it's very important, as we've seen in some health authorities now, and we are sometimes seeing at urgent and primary care centers as well, that people not present there, and we not have that we ensure that the people who need to be tested most, who are prioritized for testing, get access to testing. But those announcements about when such testing centers will happen will be the responsibility of health authorities, and you will hear from them in different communities. As noted by Dr. Henry, we now have COVID-19 cases, people living at home in isolation, recovering from COVID-19 in all 5 regional health authorities in BC. In Northern Health, the 2 cases that had been previously identified in Vancouver and in Interior Health. And finally, we want to say and give the advice of the Retail Council, there are no shortages of goods. What happens on shelves is a result of intense buying, and we are asking people to show moderation here, to one another and generosity to one another and to the people working in the stores and working in the industry, so that we work together better as a community, as a society. There are not shortages. The supply chains are strong, and we have to try as best as possible to revert to normal practice with respect to buying supplies in grocery stores and other places. This is a clear message from the industry and from the government of British Columbia. And with that, je vais dire quelques mots en français. Et puis, juste pour dire que nous avons aujourd'hui, nous annonçons aujourd'hui 9 nouveaux cas de COVID-19 pour un total de 73 cas en Colombie-Britannique. Les individus se trouvent dans les régies de santé de Vancouver Coastal, Fraser et Interior Health et ont été confirmés positifs d'après les tests du Centre de contrôle des maladies de la Colombie-Britannique. 5 cas sont liés au Lynn Valley Care Center. Un cas lié à un voyage en provenance de Portugal et les 3 autres cas sont sous enquête. Des équipes de santé publique continuent à être sur place au Lynn Valley Care Center et à la Hollyburn House Retirement Residence afin de limiter la transmission potentielle à d'autres résidents et travailleurs. And with that, we're happy to take your questions.
Thank you, everybody. We've got a number of people in the room, as well as a number of folks on the phone. My colleague here is going to give you a microphone. I'd ask if you please say your name and your media outlet before asking your question. We'll start over here and work our way around. And then we'll take questions from the phone. Thanks. Please go ahead.
Thank you. Georgie from CBC. Just with the testing centres that will be announced, we've also heard that there might be some in Abbotsford, some people seeing some stuff there. Can you confirm a location for that? And what is sort of being formulated before they're officially announced? What are we waiting for that?
Well, we're in each case we're waiting for them to be ready. So we're not announcing that something's opening tomorrow or the next day. We'll be asking the regional health authorities who are responsible for managing these issues to announce them and to let people know. But again, I think, and Dr. Henry will speak to this in a moment, it's important to note that we are prioritizing, as we should, to address issues of control and to stop the spread of COVID-19 in BC. We're prioritizing particular investigations. If you have mild illness at home, the key is to continue to self-isolate at home. So, you know, the concern always is that you announce a center and people are going to flock to that center. And this prioritization is our direction. And so that means that when new centers are open, they're not for people to descend on.
And that's for testing or treating?
Sorry. That would be for assessing. So it's assessing whether people need to be tested and then providing tests if appropriate.
And just to our media guests today, we do have a lot of questions, so we're going to ask you to please limit your question to one, and if we have time, we'll be able to come around again. Okay, next question, right behind. We'll come back.
One question from Omni News, Frank Xian. Why we are changing the testing policy, the low threshold testing policy? Is it because we are lack of the testing boxes now?
No, it's more because we have put on restrictions that mean that we're now not trying to detect certain countries around the world. We're recognizing that people are coming back to Canada with COVID-19 from anywhere. So we're asking all of them to stay at home. And we don't need to test people who have very mild illness and are isolating from others. We need to focus on clusters or cases where there's been transmission so we can stop those transmission chains. So it's a matter now of, we know we can't stop everything, and we can't stop people who've coming back from getting ill because there's nothing we can do to prevent them if they've been exposed. So we need them to not pass it on to anyone else, and the most effective way to do that is to stay away and stay isolated, and that allows us to prioritize those cases where we're seeing transmission and being able to investigate and find them, in particular to make sure that we can test anybody who's in hospital who needs care specific for this, and also for people like healthcare workers and people in long-term care homes, so that we can put in measures if needed to prevent transmission in those cases.
Dr. Henry and Catherine Urquhart with Global News. Can you tell us how many mobile testing sites there will be around the province?
No. The short answer is we don't know.
The short answer is they're developed. The regional health authorities will be making those announcements. And again, it's like all of the other issues. I think we talked about healthcare equipment yesterday. We're not announcing it's coming. We're announcing when it's here. And in these cases, we're not announcing how many there are going to be. We're announcing them when they're open. And that'll be the responsibilities of regional health authorities.
Go ahead over here.
I mean, I will say that in terms of mobile testing, we are doing that for these case investigations. When we have clusters of cases and we need to determine, we're doing testing within long-term care homes in the outbreaks that we have. So, it's being done by public health. It's being done by the people in the long-term care homes. So, there's not, and in some communities, that's how we do it. They go out and test people rather than have them come to a specific center.
Hi, Tina Lovegreen with CBC. We've been hearing that some people's surgeries have been postponed until Easter, so I'm just wondering if any parts of the healthcare system are starting to postpone surgeries because of the COVID-19.
Yeah, I know that all of the hospitals are doing the issues they need to do. Sometimes it is because of healthcare workers who've been involved in some of the outbreaks. That may indicate that certain people may not have availability of surgical services. So I'm not aware that anybody has across the board canceled services yet.
And just on that, I think we mentioned this, but I believe there are 3 cases of people with COVID-19 in the whole province in acute care hospitals, so 3 cases. So it's not an immediate struggle in acute care, but of course we have emergency operations centers who are preparing, and we have plans in every single health authority to address that question. So that there are always issues about cancellations of surgeries, and you may hear that in healthcare all the time as we manage resources, but you're going to see more of this because more adjustment as acute care hospitals prepare for what we hope will not be a significant number of cases, but we expect will be a growing number of cases.
Francis Georgian from Post Media. I was wondering if you have seen any mutation in the virus and how it's going to affect your future of developing a vaccine or treatment for the virus.
Yeah, that really interesting question. We've been doing, as I've mentioned before, whole genome sequencing on select people's viruses to try and understand where they came from, so we can tell the difference between a virus that came from Iran versus China versus Seattle or the U.S., for example. So there has been some mutation that allows us to understand some of the differences of where things are coming from. Globally, as far as I'm aware, and we do try and keep up on these things, particularly with the scientists at the VCCDC. We've not seen mutations that have led to changes in susceptibility to, or changes that seem to make it more or less virulent or make people sicker. But obviously that's something people are still watching. There is no vaccine yet, but I know there's at least 25 candidate vaccines that are being actively worked on around the world, and some of the researchers here in BC are involved with those trials. And there's also trials of antiviral medications, and remdesivir is one of them that has been used, and we do have access to it here under the Special Access Program if needed. So far we haven't had to use it.
Question over here, please go ahead.
Yeah, just in terms of universities, we're seeing some schools go into online, others still haven't closed yet. Just your recommendation on that as we're entering, of course, spring break, and then after, if there's any update.
So, and this goes along with our discussions about mass gatherings over 250 people, and many university class sizes are quite large. So we have advised universities, and we'll be working with them to do this as well. We've encouraged very much online. or virtual classes, and in any case have advised that all classes must be able to have maintained social isolation within those classes and have less than 250 people. And there's many ways of doing that. So you can stagger classes, have them at different times, have people sit separate from each other. So I know the universities are all working on those strategies.
Okay, folks, we're going to take a couple of questions on the floor from the phone, and we'll come back to the floor after that. Our first question is from Keith Baldry from Global TV. Go ahead, Keith.
Hi, Dr. Henry, Minister Dix. Given yesterday you talked a lot about people's expectations of being tested, and today that seems to be one of your core messages today. In the past, we've asked you about, are you worried about the health system getting overwhelmed? You said that's not going to happen, but are we seeing sort of a micro example of potential overwhelming part of the system in terms of the testing side?
It has been challenging, for sure. The volume of testing went up very dramatically in a short period of time. So while we had been putting in place measures to compensate for increased volumes of testing, it kind of all came at once. So there has been challenges in the labs. At the same time, we have increased the capacity in several different labs to be able to do the testing, and at the BC CDC. And you've heard as well, there's been global shortages of certain types of the materials that are needed for testing, and we're very lucky in that the BC CDC was able to develop their own reagents on site. So we're coping, but you're right, it's near the edge, and that's not surprising. But for us, it's once we put in those more sweeping measures of everybody who's coming in, we're asking them to self-isolate. We really need to focus the testing on where it's going to make a difference in terms of our public health investigations, in terms of ensuring that healthcare workers and people in hospital get the tests that they need. So that's where the strategy has shifted now.
And next question from the phone is James Keller from the Globe and Mail. Please go ahead, James.
So looking at capacity, when we're sort of thinking about what if things get worse, what is the province's current capacity in terms of ICU beds and ventilators if we do start to see a lot of more serious cases?
Yeah, so we announced the numbers there yesterday, but we can provide that. We'll send them around again. So we do have a fair capacity. We're getting more. And of course, there's strategies in each hospital around the province for how we would manage that and how we can work together across the province if one area is being more differentially affected than other areas.
Okay, our next question is from Mike Hager, also from the Globe and Mail, please. Go ahead, Mike.
Double shot. We want to know when, where, and why was the first Lynn Valley Care Center worker tested for COVID-19, and are more aides and care staff being supplied by the health authority now that a dozen workers are out of commission there?
Yes, so the first person who was identified associated with Lynn Valley was one of our community cases. So it was a person who was identified through our influenza surveillance, and that will continue as part of our testing strategy. So it was done in the lab, and her care provider thought she had influenza, and it was automatically tested for COVID-19 as part of that surveillance. So that was part of the investigation of where she contacted the virus, led us to the Lynn Valley Care Center. We do have protocols in all of our long-term care homes and hospitals to detect what we call influenza-like illness, and so that's also one of the strategies that we will continue to focus on to make sure that every ILI outbreak also gets tested for COVID-19. So, and the answer to the staffing question is yes. Vancouver Coastal has been supplementing the staff, and there have been also people from Vancouver Coastal, including an infection control practitioner and others who have been working at Lynn Valley Care Centre to make sure that all the care that's needed is available to the residents, and the staff are appropriately protected there.
Okay, Andrea Wu from the Globe and Mail, please go ahead.
Andrea's not the queue.
Okay, let's go to Amanda Follett-Hosgood from the Tyee, please. Amanda?
Hi there. I'm just wondering what supplies are being sent to remote northern communities and when those supplies might arrive.
Northern Health has been working with all of the communities around what's needed. So access to testing is something that's important. And again, making sure that it's available in the communities where it's needed, when it's needed. So I don't have the details of what Northern Health is doing in each community, but that is something that they're actively working on.
Great. And our last question from the phone is Mike Howell from the Vancouver Courier.
The federal government recommended today that Canadians traveling abroad should return to Canada while commercial means are still available. So I'm wondering what impact are you anticipating this will have in British Columbia, and how will the provincial government respond to that?
Yeah, so we noted that as well, and we expect that that means that we'll have more people returning home here. I think people need to make their own assessment, and particularly we know that there are people who spend much of their winter in the United States, and they need to make a decision about whether it's safer or better for them to stay there versus coming home. Anybody who comes back to BC and comes back to Canada will be asked to self-isolate, and again, it will fit into our strategy. If they're asymptomatic, they don't need to be tested, they need to stay at home, make sure that they are staying away from others. If they do have mild symptoms, again, our message is to stay at home, that you don't need to be tested, you need to care for yourself at home, and we will have guidance that can help people do that.
Okay, we have a couple more questions that have just queued, so we'll ask any last media who are on the phone to please queue now so we can get through those and come back to the floor. Our next question is from Bob Mackin from Breaker News. Bob, please go ahead.
Hi. Casinos are allowed to remain open even though they can hold more than 250 people. Are there health authority staff that are on site at casinos, especially the ones that are open 24 hours a day, to make sure that they're adhering to the best guidelines of social, distancing? Because, as you know, casinos do often congregate around tables and slot machines. People are moving around. They're also drinking alcohol, so there's a lot of dynamics there that could be open to spreading the disease.
Absolutely, and we also are aware that sometimes people who are have underlying medical conditions and other or are elderly may frequent those places. So there's a couple of things. One is we're asking all businesses to do their part to ensure that there is appropriate measures for social distancing, keeping people apart from each other in a safe way. And for casinos, for restaurants, for clubs, part of that should be looking at reducing the numbers of people in the facility so that you're able to maintain those social distancing. The other part is recommending to people to stay away from those communal settings if you are at high risk for having severe illness or from COVID-19. And as well, anybody who is ill needs to stay away from those places as well and should be isolating themselves at home. We also want businesses to have signage to make people aware of checking themselves for symptoms and the important things that we all do as individuals to help prevent transmission of infection. So things like hand washing, making sure there's tissues or ability to cough into your elbow and dispose of tissues, cleaning your hands, and of course staying away when you're ill.
Great. Our next question is from Ashley Wadwani from Black Press. Please go ahead, Ashley.
Hi, the Union of BC Indian Chiefs put out a statement moments before this call, calling on the province and feds to clearly allocate resources to First Nations communities to help prepare for and cope with potential COVID-19 cases. I just wanted to know, is there anything particular the province is doing in regards to First Nations communities at this time?
Yeah, so part of our response has always been, from the health perspective, the First Nations Health Authority has been an integrated part of our response. And so we are communicating with First Nations communities across the province and all Indigenous communities. And that's, you know, a really important piece of it. Our colleagues in the First Nation Health Authority are involved in all of our decisions, and we're trying to ensure that we have that in place. And I don't know if you want to talk. Yeah.
Just to say, from the beginning, every time the Leadership Council in Health in BC, the presidents of health authorities meet, the First Nations Health Authority is there, fully integrated, as they have been at every meeting that we've had in our emergency response since January to COVID-19. So they're centrally involved and will continue to be centrally involved.
Great. Our next question is from Matt Prepost from Alaska Highway News. My apologies if I mispronounced your last name. Go ahead, Matt.
No worries. Thank you. Doctor, can you elaborate a little bit more about these two cases that are in self-isolation in the Northern Health Authority, when they were identified, and the strict conditions that you talked about?
Sure. These were people who had travel, and my understanding is they were people who had traveled outside of the country, and they were identified when they were staying here in Vancouver Coastal. They are not, they're very stable. They have milder illness, so they drove in a private car and are in isolation at home.
Our next question is from Mary Brooke from the West Shore Voice. Go ahead, Mary.
Hi. Based on the data out of China, it looks like children seem to handle the virus well and are possibly asymptomatic in many cases. So I'm just wondering, for families now self-isolating at home, what are the scenarios for cross-infection between asymptomatic children, if any, and others in the household?
Yeah, so the question of children and how, and I think it's a very positive thing that children seem to handle this virus very well and have mild illness, or many have been asymptomatic. What we don't know is that if children are asymptomatic, are they passing it on to anybody else? And there's no clear evidence of that. There's been a number of family clusters, including some of the family clusters we've had here, where children have tested positive, but it's much more likely that they got it from a parent or another household member rather than them transmitting it to the household member. There's none that I have seen yet where an asymptomatic child was the first person identified. So that's one of the challenges that we have, trying to understand the role of children in transmission of this illness. And, you know, it goes to the question of schools and what are we doing around schools as well, because we know for influenza, children are very efficient vectors of influenza, and you can shed influenza days before you get really sick, and children often don't get really sick with it, although some do, obviously. So they can be very efficient at spreading it. We're not seeing that so much from children with COVID-19, and I look to countries, particularly Singapore and Korea, where schools are open still, and Taiwan, where they have not seen sort of these massive explosive outbreaks related to children. But the evidence is changing all the time, so we're continuing to assess that, and that's one of the questions that we'll be discussing with our group to try and decide about what we need to do with schools and how we can best do that in the coming days. Actually, we have a meeting this afternoon to talk about that very issue.
Okay, we're going to shift and take some questions back on the floor. We'll start over here. Please, just a reminder to please say your name and media outlet.
Jason from Fairchild TV. Just a question follow-up on the capacity of the hospital. And just wondering, do we have enough protective gear for the people who work in the hospital, and also what is the plan if we hit the shortage of the protective gear?
Yes, that's obviously something that we've been working on from the very beginning, recognizing the challenges that we're seeing in China, not only in obtaining it, but in the manufacturing process. We do have a pandemic supply, and we have been working to top that up, as well as working with the federal government and for bulk procurement across Canada. So far, we are fine, and we feel we have what we need. We need to, of course, be measured in how we're using it, and early on in this, there was a spike in people using personal protective equipment in hospitals. That has settled down as people have started to understand how this virus is transmitted and what is actually needed. So we'll continue to monitor that actively.
Question over here.
Hi, Mugali Samba with Radio-Canada. I've heard some people who have questions regarding interprovincial travels within Canada. Do you have any recommendations or comments on that?
Yeah, so far, that's obviously something we've talked about. Excuse me. So far, we know a lot about where the cases are still in Canada, and we know that the challenges really are being faced here in BC, in Ontario, but many more provinces are starting to see cases as well. But we've all been vigilant and watching for this, so it's still safe, I believe, to travel in Canada. But again, we want people to be really, really sensitive about how you're feeling. And if you're not feeling well, if your kids aren't feeling well, stay home, stay away, stay in wherever it is you're going.
Just get a comment in French about that as well, and also about the stores, perhaps.
Ce qui est différent avec de voyager au Canada, en comparaison, par exemple, avec les voyages aux États-Unis, c'est que toutes les provinces comprennent en quelque sorte la situation dans leur propre province. On travaille très étroitement ensemble, donc on connaît des risques. Cela étant, il est absolument nécessaire que si on est malade, on ne voyage pas. Et ça, c'est que ce soit l'Alberta ou Washington ou Singapour, où que ce soit, ne voyage pas si on est malade. Et effectivement, si on voyage dehors du Canada, bien entendu, il faut s'isoler pendant 15 jours. Sur la deuxième question que vous avez posée, c'est évident qu'il n'y a pas un problème de produits dans les épiceries en Colombie-Britannique, et il faut que les gens trouvent un certain calme là-dessus. Il n'y a pas un problème. De temps en temps, on a acheté et on n'a pas encore remplacé, mais c'est important de prendre un moment, de prendre un souffle et de ne pas participer à des processus d'acheter tout ce qu'il y a dans un magasin, parce que ce n'est pas nécessaire et ça contribue, je pense, à un manque de compte dans la société. Et si on va là-bas, il faut traiter tout le monde, ceux qui cherchent des produits et ceux qui travaillent là-bas avec générosité.
Okay, we've got just a couple more questions here on the floor. Please go ahead.
Great. It's Alison, CTV. If I can just return to testing for a minute, please. In Ontario, they're starting to pull back with a shortage of nasal swabs and essentially rationing them. Has that had any impact here? Are we seeing that? Are we concerned? And is that why maybe some testing?
That's not why we've changed our strategy. That is something we've been watching very carefully, and I have to say, in the public health labs across the country have all been working together on this, and we think we have a solution for that. We have not had a shortage of the test swabs here in BC, and the BC CDC has been looking at the use of a different swab that we have quite commonly, that we use for testing for I don't know if I should. Testing for sexually transmitted infections. I just laugh because we have a brilliant scientist, medical microbiologist who works at the BC CDC, and he's Dr. Melkraj, and I have to say, he figured out that if we use those swabs, and he did a validation to see if they work just as well as the special ones that we use for nasopharyngeal swabs, and so far it's looking really good, and we have lots of those in the country. So that's something that I think is a really interesting and good story.
Okay, question on this side of the room here, a couple more, and I believe we do have a couple more questions on the phone as well.
Excellent. Georgie again from CBC. Just a message to our camera too, if we can include the translator as well, please, on that shot. Yeah. Just with the last few weeks, we've seen a lot of information from data analysts that look at what's happening in Italy, what's happening in Korea, and we're seeing these phrases that the UK is X amount of days from being Italy and seeing what's happening in Italy, that sort of thing. And analysing at the transmission levels in particular countries and how many actual positive tests we have that sort of thing. How helpful is that data analysis and looking at countries of where they are and where we might be? Do we have any number like that in BC, and is that data analysis helpful at all?
Yeah, so then it's modeling. And so it gives us a sense of what we could compare, but it doesn't take into account, and that one in particular doesn't take into account measures that were taken and when they were taken. So we have been very focused on breaking transmission chains and flattening the curve, as we've been talking about. And so it's not a direct translation to say, okay, well, Italy had this many cases then, and this is what happened. So it does give us a sense of what could happen if we weren't doing the things that we are doing. But we are also looking at, other countries looking at modeling and giving us a sense of where we might see surge and planning towards that. So we do use it to help us understand. And it's really not, we talked the other day about Minister Hadju had said 30 to 70% of people might be infected. And whether it's 1/3 or 2/3 really isn't the issue. It's really how fast that happens. And so we are focusing all of our efforts on trying to decrease the amount of transmission that we have in the community. And that's why it is so important for people to stay away from long-term care homes, to stay home when they're ill, to self-isolate regardless. And you may not need to be tested, you just need to stay home and prevent transmission to others. So the modeling helps inform us, but it's not a prediction at all.
Question for Minister. With the run on the stores that are going on right now, and can you please sort of explain if there's any plans, if this continues, can the supply chain stand the stress? And if not, if the provincial government has any plans regarding this, that how, if this continues and stores are not able to supply enough and too much stress on the supply chain, is there a plan that you guys have to address this?
Well, yes, there would be plans in that regard, but that's not the issue right now. The issue is a significant amount of, however you want to describe it, excessive buying that's taking place. It's not a stress on the supply chain. The supply chain is adequate, but at a given moment, if people are in buying lots of particular products, then that will obviously have a profound effect on the chain, but really on the existing circumstance. And so it may well be that retailers will limit certain products, but that's really only out of respect to other customers, so that we don't have a situation where 3 people wanted 4 of something and 1 person took 12 instead. So retailers will no doubt work on those strategies. But the Retail Council of Canada has been very clear on this question, that the supply chains are good. You see this in stores. They are restocking, and then they're facing new buying. So what we're asking people to do is everything in moderation, and to be respectful of one another, of the stores, and of their real needs. But there isn't any pressure on the supply chain as we speak, and the retailers have been pretty clear about that.
Just wondering how many people have recovered. Also, we've been getting calls from viewers saying they've noticed some of these tents going up outside the hospitals for this mobile testing. And I appreciate that the health authorities are going to make their own announcements, but will they be active, do you think, like within days or weeks? What can people expect?
But in terms of the recovered, most of the cases that we've had so far have recovered from symptoms. But we are using testing to help us say when they're fully recovered. And I think we reported yesterday that there were 6, but I take that back. There's 4 that have had cleared testing. There's 2 people that had 1 negative, and we're waiting for a second negative. So, but there's more evidence that's coming in that says that if you've recovered from your illness, even if you shed a little bit of the virus, that may not be live virus, so you may not be infectious to others. And so we're looking at that data to see if we have to continue to keep people in isolation for that long, whether we can just do a period of time, and that'll be important for helping understand, when people are clear to leave isolation. And it's looking like for most people, once your symptoms have resolved, 8 days would be sufficient. But I won't say that for sure yet. There's evolving evidence around that we'll be looking at in the coming days.
And yes, health authorities are addressing strategies to deal with potential lineups in places, and you'll see those perhaps at urgent and primary care centers or outside of hospitals, just to make sure that the situation in those places is reasonable for people who are seeking care. And so what we're saying is that the health authorities are doing that. They're doing that now. They have been doing that for a period of weeks. And what we're emphasizing, though, to people is the priority of things, the changing priority of things. We need to focus especially and first on the tests that we need to protect the whole public, including all of the people who are self-isolating, and that means focusing on healthcare workers, focusing on clusters, as we've been doing. And so that's going to be reflected as we triage. These are not testing centers; they would be viewed as assessment centers, and so when people are considering that, they should consider it. And certainly you're going to see, and obviously the health authority has to manage a situation where there's lots of people there or lining up, and they're looking at strategies and working through strategies on a daily basis to deal with that.
This question is for Dr. Bonnie Henry of Ashley Burr City News. A lot of people, we've talked about this before, signs and symptoms, but I think with the level of paranoia, it's helpful for people, again, to talk a little bit about, when you're checking in with yourself, it's also allergy season a little bit too. Are people presenting symptoms in the same way, or what should we be really focused on when we're trying to evaluate ourselves?
Right. So the challenge has been that early on, particularly, this can look like a variety of other things. So you're right, allergies, runny nose. The most common symptoms that we're seeing in people who are positive for COVID-19 is a dry cough, fever, and then shortness of breath or difficulty breathing. But people also, especially early on, talk about aches and pains and that sort of feeling that I'm fighting off something, and that can be a trigger that you're starting to be in the infectious period. So we are telling people to be really, really sensitive. We know for children and for some people, it also has some upper respiratory symptoms like runny nose and sore throat, and so those are things that's the challenge, and that's why we are so lucky we have a test for this for those who need it, because otherwise it's really challenging to understand who has this and who doesn't. So for the really important thing for everybody is even if you have the sniffles and a little bit of a sore throat, feeling like you're unwell, stay away from others until that resolves.
Mugali Samba, Radio-Canada CC. Just regarding people who are arriving here in Canada as tourists but aren't Canadian citizens, would they have access to free testing?
Yes, we are providing testing because it is an urgent public health issue. Anybody who needs the test is available for free.
Okay, we're going to switch back to the phone just to wrap up our briefing today. We've got a couple more questions there. The first question is again from Keith Baldry from Global. Keith?
You sort of just answered this, Minister, but back to these centers, assessment centers or testing centers, how concerned are you that crowd control is actually going to be a problem here, given the behavior we've seen, the somewhat irrational behavior you see at places like Costco and buying things you normally wouldn't buy? Would you worried about the behavior that could occur here, particularly if there's any drive-through situations?
Well, I think that's why, and the health authorities are working and taking those questions very seriously. We had, in a couple of cases, we've had a lot of attention early on, and then as people get triaged, people come to understand the purpose of it. What we're asking people to do is listen to the advice given by Dr. Henry and to self-isolate. There's no, it's not an absolute need to be tested, and what's important for the whole community is that we have as fast a results as possible and as good at testing as possible when we're investigating clusters, so we can help to the extent possible break chains of transmission, so that we're protecting healthcare workers and other priority tests. And so we have to do that, and that requires people to do what we've been advising them to do, is that if they have mild illness, to stay home and to self-isolate and to help to get better. And obviously, if things get severe in any way, then they engage with the healthcare system, and that's what we're trying to do today. It's not an issue. We've done an extraordinary amount of testing, 4,000 in the last week, but which is, compared to other jurisdictions, a lot of testing. But we've got to make sure that testing is focused on the greatest need for everybody's protection. And that's what Dr. Henry has announced today, and that's what the health authorities are going to be implementing.
Great. We have time for 2 more questions. Mike Hager, please go ahead.
Sir, when that worker was tested by, I'm guessing, her GP or a walk-in clinic doctor, can you just explain that?
Are you referring to the person who was connected with the Lynn Valley Care Home?
Yeah, the original, the first staff member who had community transmission and through influenza surveillance tested positive.
She was tested by her primary care provider, so by her physician in the physician's office, and received an NP swab that was tested because they believed she had influenza. So that was done in a physician's office.
Okay, we'll take our last question today. James Keller. James, please go ahead.
Hi, just a follow-up on the ventilator issue. I've got the numbers now, so thanks for that. What is your sense, though, of what we could need, in terms of best-case scenario, worst-case scenario, if this escalates, and what are the challenges in ordering new ventilators now, when I assume we would be competing with pretty much every health jurisdiction in the country, if not farther afield?
Certainly people are purchasing them around the world, and there's different types of ventilators, so I think that's included in the statistics that we have. So they're used for different reasons and in different places, and it depends a little bit on what type of surge we see. So we have been planning for that. We've looked at some of the worst case scenarios, for example, in some parts of Italy, and we've looked at other places where they've done better. So our measures are really to try and make sure we don't end up with a large number of people on ventilators. But the other key thing around ICU and ventilatory capacity and ECMO, which is the extracorporeal membrane oxygenation, is the people, the skilled nurses, physicians, and perfusionists that are needed to make sure that they can be used appropriately. So that's the other part of what we're planning for. I don't have numbers off the top of my head of what the maximum could be and what the minimum is, but we are obviously looking for making sure that we have extra capacity, as are our colleagues across the country, and we do have some capacity in our national emergency supply stockpile as well. The other thing that I think is really heartening to hear is I know that China has been, now that their cases have decreased quite dramatically, they have been looking to assist other countries, and I understand they're sending a team of medical professionals and ventilators to assist in Italy. So I think as a global community, we need to start thinking about how we best help each other out for that sort of thing. Right now, we hope, we think that we have enough and that we can move resources around as needed. And we will continue to monitor that as we go through this.
Thank you, everybody, for joining today. That concludes our media briefing. Just a reminder, the next scheduled briefing is Monday at 10 a.m. Thanks very much.
So, Dr. Farmer, you're the medical director here at the United Nations. You've been here for 7 years. Have you ever seen anything like this?
Not really. We've managed a couple of significant disease outbreaks during my time. We've dealt with the Ebola outbreak in West Africa.
When was that?
That was in 2014.
Right.
And more recently we had the Zika outbreak. But this is the first one that has so directly impacted New York City.
New York City, that's right. These were distant outbreaks. The level of anxiety, though, you've told me, was actually really high, even though Ebola was in West Africa. Still,
it was.
But here, this is different. What is different?
The difference here, the first thing is the sense that this is spreading, and it's just that there's no way to know if the person you're with might be able to infect you or not. People are really worried about their loved ones. I think all of us were imprinted really early in the outbreak with some of those very distressing pictures coming out from the first epicenter of the outbreak. And there's not been as much information conveyed about the very broad spectrum that this disease can take, and that the majority of people who catch it will have mild disease.
I think
so people are afraid.
And that's really important, that people are, what the Secretary General put out a message yesterday saying, people should fear the virus, but fear can also go viral. And I think a lot of misinformation out there is causing more fear than the illness warrants, or?
I think that's true. It's important to be aware, it's important to be proactive, but it's important to not let that frightened part of your, what I call your reptile brain, take over. You know, we have this fight or flight mechanism, and people are so afraid that even though they know things, it's not necessarily guiding their actions. And so we are really aiming to make sure that people are equipped with enough information to be able to approach this in a calm and measured way. It's a bit scary, but at the moment, we live in New York City, you're more likely to have a pedestrian accident than to end up in intensive care from this virus.
That's right, but yet people are extremely concerned. Yes. There's still quite a lot of anxiety among staff, and what do you think that they need to know right now?
The key thing to know is that the great message from the Centres for Disease Control, keep calm and wash your hands. That's the most important message. We've all got the tools that we need to keep ourselves safe, which is hand washing, hand hygiene, and you don't need alcohol hand rub. You don't need to pay $25 for a tiny bottle of it. You can use soap and water. Maintain your distance, particularly from anybody who is unwell. And what I'm asking people to do is to just flip their thinking about coming to work when sick. A lot of us, when we wake up in the morning with a funny little tickle in our throat, will come to work until we're sure that we're sick, and then we might go home. I want people to stay away from work until they're sure they're well. And so if in any doubt, don't come to the workplace, protect your colleagues, and then seek advice is what we want people to do.
Apparently in Japan and Korea, the influenza that is usually rampant at this time of year has also decreased markedly because people are taking these measures. So do you think it's going to have a long-lasting impact on how people protect themselves against illness?
That's a really interesting question. I think the human nature is to normalise our environment. So even with COVID, eventually we'll be thinking about it very similarly to how we think about colds and flu. And so I don't think we'll see a permanent and dramatic behaviour change, but as long as it's sustained long enough to get us through this, that's good enough.
Right, because right now our immune system, from what I understand, you're the medical profession, has never been confronted with this virus. So what is happening and who is particularly in danger?
Okay, so the reason that this is that this has become a pandemic, and the WHO made that call yesterday, is because this is a completely new thing that nobody has ever seen before. Diseases spread rapidly through communities when you have less than 90% immunity. So we aim for 90% immunity to get what's called herd immunity, because then it doesn't jump from person to person to person. We're starting from a space of zero immunity because it's a completely new virus that's never been seen before. And that means that it is going to progress its way through the community. And the goal of the phase that we're in at the moment is to slow that down so that it doesn't peak. There will be people who get sick and who need hospital care, but we don't want them all needing hospital care at once. So each of us contributes to that by our social distancing, by hand hygiene, by not touching our face, by being aware of where we've put our hands, and being careful to engage in hand hygiene when we return home to loved ones if we've got anyone who's vulnerable.
I think one of the top concerns among staff and people in the city and around the world is, how can I get tested? Apparently there are perhaps not enough testing capabilities, as there would be people who would want to have tests.
Yeah.
What are you recommending in this circumstance?
So I think we just have to be pragmatic. We're the UN. We operate in some of the most dangerous and difficult locations on Earth, and we don't blink. And so we can deal with this. So what I'm recommending to people is let's not obsess about testing. Testing, when it's available, is very helpful in managing an outbreak. It really is, and that's why one of the WHO's priorities is to ramp up testing. It always is in an outbreak. But when testing is not available, or if you're told that you don't qualify for a test, then we just proceed with managing it as an infectious disease. So we don't seek confirmation of infectiousness every time we have a runny nose. We just isolate ourselves. And so in these circumstances, if somebody believes they have the condition and is told that they don't qualify for testing, the advice is still going to be stay home until you're well, and then for a period of time after that.
Just a last final question. You operate the medical services for the United Nations here. What is your role normally? I mean,
well, it's not in an emergency room.
Right.
This used to be my world, but
Yes.
I don't do direct patient care anymore. But I basically run the internal healthcare system of the United Nations, which means that I'm responsible for the on-site health services, the occupational health services, all of the medico-administrative benefits related to health that come with the UN fall under my purview. And I'm also responsible for the governance and oversight of all of the healthcare facilities that are operated by the UN around the world. So whenever you walk into a clinic that has a UN affiliation, that's something that I'm responsible for the workforce and the clinical quality and standards. And at the moment, infection control and training and PPE and preparedness to get all of our clinical sites ready for the arrival of the virus in their working environment.
Right, and you're talking about workspaces around the world.
That's right. So we operate over 400 healthcare sites around the globe. Most people are really unaware of that. It's like an entire healthcare system. Many of them are very small, but they perform a really vital function. So getting the workforce there, ready to practice safely in an environment of a spreading virus has been a key priority of ours. Since the middle of January, we started running training and making sure that they had their PPE, their personal protective equipment, and were ready to operate if a person came through the door meeting the case criteria.
Right, and most dramatically, we're seeing measures being taken here in New York for staff, in Geneva, and in Vienna. What about some of the other operations around the world so far? So far, I mean, the two sites that have been the most impacted, where we have UN personnel really working, and has been in the development arm of the UN rather than in peacekeeping. And so the Chinese, the offices in Beijing and throughout China, obviously bore the first brunt of this, and Iran. So we've been in close communication with those teams. We don't have healthcare sites in those organisations, so we support them remotely, and we also engage with local providers to make sure they can get access to care. And I think we just keep calm and wash our hands. Keep calm and wash our hands.
Yeah.
And I won't shake your hand, Dr. Farmer, but thank you very much for
You're
this
very
discussion.
welcome.
Stay well. Thank you.